For those who might be new to the issue, this all came about because in 2007, Massachusetts versus EPA, the U.S. Supreme Court determined that 6 greenhouse gases qualified as air pollutants under the Clean Air Act. And then this ruling affirmed that the U.S. EPA has the duty to regulate the gases if they can demonstrate that they are harmful to public health. So then in December 2009, after thorough study, the EPA did determine that greenhouse gases pose a threat to human health. So this determination obligates the EPA to act. Now, many in Congress think that it should be their task to determine what we do about global warming and greenhouse gas emissions, but as temperatures rise and more Americans are exposed to weather conditions that may exacerbate asthma, cause heat-related death or problems, we simply can't wait any longer to act. And so we should move forward with clean energy legislation and not move forward with dismantling of the Clean Air Act.
Well, good morning. I'm Dr. Walter Sue, and I thank you for here. I'm a public health physician. I'm actually the former president of the American Public Health Association and the former health commissioner for this city. So I'm very interested in adding my voice to others for supporting strong climate change legislation and to oppose the Rockefeller Amendment, which would restrict or delay the enforcement by the EPA of clean air regulations. So as other people have said here, climate change is a real event, and it represents the largest environmental threat for this planet. In this city, in 2008, we exceeded the national ambient air quality standard for ozone and particulate matter. In 18 days, they were considered unhealthy. There were 144 moderate days where we had exceeded the standards. And in addition, we've also had several air toxins which were detected in concentrations that would result in excess lifetime cancer risks of more than 1 in a million. The Public Health Management Corporation has been tackling the issue, tracking the percent of adults who have asthma in the 5-county area since 1991. And in 91, 4.7% of the adults over age 18 stated they had asthma. In 2008, the number had gone up to 14.1%, and it's increased every year since they've been doing this survey. That represents a 300% increase in the number of people who state they have asthma. So behind all these statistics, of course, are families whose lives have been disrupted by shortness of breath, hospitalizations, and increasing healthcare costs. The leading medical cause of truancy in our schools in Philadelphia is asthma. And we can't minimize the impact that asthma has had on many, many Philadelphia families. I can only add that as a public health physician, we have the ability and the means to stop this air pollution in order to leave this world just a bit better for our children than the one that we have today, and the only thing we're lacking is the political will to do it.
I'm only one of millions with asthma. I'm not alone. I have a lot of company there. The inhalers, which you may use 2 of every month, cost between $125 and $325 a piece. As soon as you add that up, you're over $6,000 in cost annually. That's before you get to doctor's visits and pulmonary function tests, which come out at $400 to $600 a pop, and emergency room visits. When I look back at my own records, you're talking $4,500 to $15,000 for each and every one. In a good year, I might only have to go once. In a bad year, it might be 10 or 12 or more times. I'm actually very, very grateful to the presidential and Senate and congressional leaders who have advanced the Clean Air Act. But there's much more that needs to be done. And I just, in closing, would note that if we don't change the status quo, if if we don't continue to improve the quality of our air, what we are doing is building our transportation and energy and commercial infrastructure on the broken health of our children and our elderly and everybody in between. So I would really urge strong support and advancement of the Clean Air Act and really ask everybody not to weaken it.
The American Lung Association's position, of course, with respect to the proposed measure by Senator Rockefeller, and any other measure that would seek to delay implementation or restrict or completely gut the Clean Air Act, anything along that line, the American Lung Association is clearly in opposition to those kinds of measures. There's no reason why the Act should fail to be implemented in a timely and proper course.
The Clean Air Act was designed specifically to address air pollution that impacts human health. Why is it that some senators are now rushing to try to limit EPA's role in enforcing the Clean Air Act? The only people that benefit when we delay putting limits on pollution are corporate polluters. Today, we call on Senator Specter and Senator Casey to block all attempts in the Senate to weaken EPA's authority. Thank you very much.